Hi everyone, welcome to another episode of Tiny ADHD Superpower. Today it's episode 65 and we're going to talk about ADHD and opioids. Opioids don't work for every person or the type of pain that they experience. However, literature has suggested a higher rate of psychiatric comorbidity in opiate-dependent patients with ADHD. Further, patients with opioid dependence have ADHD are more likely to have impulsivity and more likely to have a poorer quality of life. The findings suggest that ADHD symptoms, particularly impulsivity, may contribute to the vulnerability in opioids use and play a crucial role in treatment outcomes for this population. Research shows that teenagers with ADHD are also more likely to abuse substances like drugs and alcohol as well as opioids. Kids with ADHD may be drawn to substances that make them feel calm, plus it brings them more sensitive to drugs. It really depends on the person. This can make them feel the effects more intensely and sometimes get addicted faster. So, how do opioids affect people with ADHD? Opioid use disorder may exacerbate ADHD symptoms over time and cause greater functional impairment, leading to an increased rate of ADHD diagnosis among patients with opioid use disorder compared with the general population. High-dose opioids cause reversible cognitive and behavioral changes. The sedative effect of the drug impairs people's ability to pay attention and concentrate, which is exactly what ADHD is and needs. So why would you do opioids? Opioids can also affect abstract thinking. That's what we're good at. So why would you take opioids? It becomes difficult to think around issues or to understand situations from a different point of view. Next, how does methylphenidate or Ritalin affect opioid receptors? Wilens and colleagues reported that immediate release methylphenidate was the stimulant most often reported by subjects who diverted 83%, or misused 75% their medications, followed by immediate release mixed amphetamine salts 33%. High dose of methylphenidate unregulated activities of the mu opioid receptors and the induced conditional place preference. Co-administration of naltrexone and methylphenidate prevents the U opioid receptor unregulation and conditional place preference. Now, let me talk about something. You guys can read this. Let me talk about something else even more interesting. Mixing stimulants with opioids. This I find interesting. People mixing with stimulants and opioids is not a new phenomenon. Mixing heroin and cocaine, called the speedball, was fairly common practice in the 1990s. For instance, more recently, mixing fentanyl and methamphetamine is what known as goofball. It's a growing trend, but according to a new paper put out by the University of British Columbia, by University of British Columbia, people mix these up and downers in intricate, measured way, rather than just throwing them all together as a drug cocktail, and do so for a number of specific reasons. So, let's get into that. Through the interview, the paper identifies several reasons behind mixing meth and opioids. Largely, people use goofballs because they offer an experience that they would not get from using either drug individually. Epstein's told Filter paper that there were three broad motivations, depending on what the individual was trying to achieve. Some people mix a little meth with their opioids to prolong the effect of the opioids, particularly short-acting fentanyl, to give it more legs. That's what they say. I never heard of that. People complain a lot about fentanyl not having a very good leg. It doesn't last very long, since the doctor said, or the researcher. People who use opioids also added meth in order to foster some energy, to enhance the euphoria that comes with opioids by giving it a bit of a kick, he said. Meth would seem to counteract the sedative effect of opioids. Well, duh. Allowing people to enjoy the high without nodding out, or I guess burning out is another word. Respondents said that there was particularly important when using in public because it can be risky or somewhat dangerous to fall asleep in public areas when you're on fentanyl. It could increase the risk of theft and violence as well. Other people, meanwhile, will principally use stimulants, but adding some opioids in order to smooth out what I've been saying sometimes can be an intense experience. That means the dosing is not proper, and it takes trial and error to get the dosage right. So, what is the conclusion? I cannot support opioids. I can't. This video is completely based on scientific research evidence that I have retrieved from online as well as books. I can't say I support opioids because fentanyl has killed way too many people, and I cannot support that. But if you talk to your, psychiatrist or doctor, I think that is the best way to go. And my suggestion is do not touch fentanyl. You do not want to die. Please, just listen to me. Look in my eyes. Please do not die. Please do not touch fentanyl. You have ADHD. You have superpower. Use that. Stop using fentanyl.